All right, so are you ready?
Ready yet?
Okay, so examinees prepare. You may now begin your encounter. You see the information?
I do, yeah.
Okay, great.
Knock, knock.
Yes, come in. The patient is sitting still with her back slightly hunched and her head straight ahead.
Okay. Hello, Miss Holland.
Hi, doctor.
Hi, my name is Dr. McCarthy. Pleased to meet you.
Nice to meet you too, doctor.
Thank you. Miss Holland, is this how you like to be addressed?
Yes, that's fine.
Are you comfortable in the room?
Yes, I'm comfortable. Thank you for
Uh,
asking.
yeah, you're welcome. Let me make you more comfortable by putting this drape around you.
Okay, thank you, doctor.
Yeah. So today I'm going to be asking questions, doing a brief physical examination, and at the end giving you my impression.
Okay,
Do you mind if I take a seat and write some notes?
not at all, doctor.
So how can I help you today, Miss Holland?
Well, doctor, I have some pain in my neck.
I see. Can you tell me a little bit more about that?
Well, it's been going on for 2 days now,
Hmm.
and it's not getting any better.
I see. Were you doing anything at the time when the neck pain came on?
Well, someone called my name, and I turned my head to the left to look, and I noticed it just started to hurt after that movement.
I see. And did the pain come on suddenly?
Yes, I can say it came on suddenly after that move when I moved my head to the left.
Okay. And is it getting better or worse?
Well, it's actually stayed the same since it started.
Okay. Is the pain constant?
Well, I would say it is there throughout the day. Yes,
Mm.
doctor.
Okay. Is there any times when you don't have the pain?
I can say once it started 2 days ago, no. I mean,
Mm.
now it changes in its, severity, but
Mm.
I have it throughout the day.
Okay. And if you were to point with one finger exactly in the neck, can you show me where it is?
Well, it's the whole neck, but I notice it's worse on the left.
Okay. If you describe the pain out of 10, one being the worst, sorry, one being the lowest and 10 being the worst, how would you say the pain is?
Well, when I'm at rest, it's about a 2 out of 10, and then when
Hmm.
I move it, it goes to an 8 out of 10. So
Hmm.
it hurts pretty bad when I move my neck.
That's quite bad. At the moment, how would you say it is?
Right now, sitting with you, doctor, I'm sitting still, so maybe about a 4 to 5, but if you ask me to turn my neck, it's going to hurt really badly.
I understand. So I'll make sure I'll get my nurse to give you some pain relief after.
Thank you, doctor.
And how would you describe the pain? Is it, for example, is it a sharp pain or a dull pain?
I would say it's sharp.
Okay. Does the pain go anywhere?
Well, yes, it kind of shoots down to
Mhm.
my left arm.
Okay. Anything that makes, so you mentioned about turning your neck makes the pain worse. Anything
Yeah, if
else?
I turn it either direction, it makes it worse.
Okay. And anything that makes the pain better?
Just holding my head still makes it better.
Do you have any other symptoms with other than the pain in your neck?
Well, I could say when it moves down my arm, it seems like my
Mhm.
arm tingles. I get like
Okay,
this, little tingly feeling down my left arm.
I understand. And how has this affected your life?
Well, I can tell you it's not enjoyable. I'm not able
Mhm.
to, I'm retired, but I'm not able to do my housework.
Mhm. I
It
see.
is affecting it somehow. Yes, doctor.
Mhm. You said you're retired. What used to work as?
A magazine editor.
Okay. And when did you retire?
Oh, years ago. I would say
Oh,
in the last maybe about over 10 years now.
okay. So you mentioned that you get this tingling sensation down your, is it your left arm?
That's my left arm, doctor.
Okay. Do you have any weakness in your left arm?
No, no weakness at all. Just tingles.
Okay. Any numbness?
No numbness.
Okay. Do you have any fever?
No, I don't feel feverish at all.
Any sensitivity to bright light?
No, doctor.
Okay. Do you have any medical conditions?
Well, I have osteoporosis. I was diagnosed with that,
Mhm.
during my last screening,
Okay.
and I'm taking some stuff for that, calcium and vitamin D pills.
Mhm. And how long? When were you diagnosed with osteoporosis?
My last screening, which was a few months ago.
Okay. Do you have any pain in any other joints?
No, doctor, I don't have any pain in other joints, just my neck, and
Okay.
now this pain that's going into my left arm. But that's it.
Okay. Do you have any stiffness in your joints?
No stiffness, doctor.
Okay. Any redness or swelling?
No, no redness or swelling in the neck.
Okay. Does it feel warm to touch?
No, doctor.
Okay. Do you have any cough?
No, doctor.
Any chest pain?
No,
Any palpitations?
no, doctor.
Any shortness of breath?
No,
Okay. Any problems with your bowels or passing urine?
no, not at all.
Okay. Other than the osteoporosis, do you have any other medical conditions?
Well, no, that's the only thing my doctor diagnosed me with.
Okay. Have you ever had pain before in your body?
No, but I did throughout my neck before. Not like this, but I
Oh,
remember, maybe
okay.
years ago having a similar pain, but it
Mhm.
wasn't this excruciating.
Okay. And can you tell me a little bit more about that pain you had before?
Well, I don't know what triggered it, but I could just tell you it was this kind of again around the whole neck, more worse to my left.
Yeah.
And it's just the same pain, but very, very light. Not like this. Not like this. This one is much more severe.
Okay. And did the pain go on its own, or did you
Yeah,
have to?
it went away on its own, doctor.
Okay. Do you have any allergies to any medications?
No, doctor.
You mentioned that you're on medication for the osteoporosis. Can you remember what it is?
Yes, calcium and vitamin D supplements my doctor needs me to take. So I've been taking them every day.
Okay. And other than that, are you on any other medication?
No, doctor.
Okay. Any hospitalizations in the past?
No,
Any injuries?
no, doctor.
Any traumas?
No,
Any surgeries in the past?
no, doctor.
Okay. Is there any family history of any medical conditions?
Well, my mother had osteoporosis.
Mm.
My father died from a heart attack at 68.
Okay, I'm sorry to hear that. So I'm just going to ask a couple of questions about your obstetric and gynae history. Um, are you on are you on the pill or any medication like that?
Oh well, I'm not a I don't get my periods anymore.
Yes. Oh yeah.
It's been years ago.
Okay. Do you have children?
Yes, I have children. They're all grown now.
Any miscarriages in the past or
No,
abortions?
doctor. No,
Okay.
no miscarriages.
Okay. And who's living at home?
Well, just me and my husband.
Okay. Do you smoke?
No, I don't smoke. You have
Okay.
5 minutes remaining.
Do you drink alcohol?
Just a glass of wine with dinner on the weekends.
Okay. Any history of recreational drug use?
Oh, no, never, doctor.
Okay. I'm just going to ask a couple of questions about your sexual health. Everything is confidential. Are you sexually active at the moment?
Yes, still with my husband.
Okay. Any history of sexually transmitted infections in the past?
No, doctor.
Okay. How is your weight?
Well, I've lost about 10 pounds in the last 6 months.
Mhm.
Um, I guess it's old age. I don't know.
Do you have fatigue?
No, I don't feel tired.
Mhm. This weight loss, is it intentional or unintentional?
Unintentional.
Okay. Do you know anything that could be causing this weight loss?
I have no idea, but I can tell you that my appetite has decreased over time. Maybe it's that.
Your appetite, sorry, is decreased.
Yeah, I don't feel as hungry as I used to.
Mm. It, okay. And had you exercise?
I'm supposed to be exercising. I try to, but with this neck pain now, I don't know
Mhm.
what's gonna happen.
Okay, I understand. I forgot to ask, any blood in the stools?
No, doctor.
Any night sweats or fevers?
No, doctor.
Okay. And do you feel tired?
No, doctor.
Okay. Any travel abroad recently?
No, doctor.
Okay. Okay, Miss Holland, I'm just going to summarize what you told me so far. So you mentioned you've had this neck pain more on the left-hand side. You describe it's happened about 2 days ago. You turned your neck to this side. It's a sharp pain. It's shooting down your left arm. You described tingling sensation, and there's a family history. Your mother has osteoporosis, and you were diagnosed with osteoporosis a few months ago. Is there anything you'd like to add?
No, doctor.
Okay. Is there anything I forgot to ask?
I don't know. I don't think so.
Okay. So what I'm going to do, I'm just going to do a brief physical examination, Miss Holland. So what
Hmm.
I'd like to do is I'm just going to examine your neck. So I'm not going to ask you to move it because you mentioned causes some pain. So I'm just going to feel along the neck. Okay.
Okay.
Okay. So I'm just going to feel along the back as well. Okay. Okay. So are you able to just look up with your eyes? You don't have to move your head. Okay.
Hmm.
And look down.
Okay.
So I'm just going to feel your neck. Okay. 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 So I'm just going to move your arms. So okay. Let me know if there's any weakness.
Okay. There's
Okay.
no weakness in my arms, just that tingly feeling I get in my left arm.
Okay. So push against me. Okay.
Okay.
And
So
push.
motor's intact
Okay.
bilaterally.
Okay. So I'm just going to check for your reflexes. So on both sides, biceps, triceps. Okay. So I'm just going to check for sensation. Can you close your eyes for me?
Okay.
Okay. And so I'm just using. So can you feel this? It's a cotton wool bud on
Yes.
both sides.
So sensations intact bilaterally.
Okay. So I'm going to use a pin as well on both sides.
Okay. So I answered correctly. Sensations intact.
Okay, thank you. So I'm just going to feel for your pulses as well on both sides and at the wrist.
Okay.
Okay, Miss Holland, thank you for allowing me to examine you. So based on the history and physical examination, there could be a number of causes for this neck pain. One thing could be what we call a prolapse disc in your neck. The other possibility could be a fracture. Other possibility I have to rule out is cancer. You mentioned you've had some weight loss as well, so I'd like to investigate that further. So what I'd like to do is I'd like to run a number of blood tests, just check for anemia.
So your time has now ended. So you can keep going. You can finish up.
I'll also like to do an X-ray of your spine and an MRI scan as well. And once I get the results, then I'll be able to get a better idea what's happening.
Okay,
Is there
doctor.
is there anything you'd like to ask?
Well, yes, I'm supposed to visit my sister in Florida in 3 days. Will I still be able to go?
At the moment, I'm concerned about this neck pain, given that it's quite you rated quite high. So I'd like to outrule any serious conditions first before I permit that. If that was okay.
Okay, doctor.
Okay, you're welcome.
Okay. Okay, thank you, doctor.
You're welcome. You're welcome.
Okay. Did you want to counsel her on anything?
Um, neck pain.
Well, think about it. This is your patient.
Patient.
Remember, she has to exclude, remember, she moves her neck. Any movement of the neck
Oh yeah.
make it turn to an 8. So what would you want to say to her?
So I'd advise not to move until
Yeah, not to move
not.
it as much. Maybe if we can provide you with a brace now, that'd be great.
Okay.
Because remember, you don't want her damaging her neck further, right? And remember,
Yeah.
you're not really doing the testing that moment, but
Yeah.
so you have to, kind of think of the patient being your real patient.
Okay.
Okay, so let's talk about timing. So this time you were outside the door at a good time. You stayed about a minute, but I noticed that your questioning is, when you're questioning the patient, you're very slow with that. I know
Okay.
you're thinking while talking, but the whole purpose of the 6 into 4 again is to make it faster. Now,
Yeah.
when you're on your OPD section, that should still go a little bit, shouldn't take too long because you do have the mnemonics there to help you. And that's
Yeah.
why we have the mnemonics there. It kind of provides that substrate, where you can still think, but the next question you're going to ask because the mnemonic is there. So you asked me, tell me more. I gave you onset, and I told you that it's pretty much been, it's not, hasn't gone away. So I gave you onset.
Yeah.
So now want to ask, was it sudden or gradual? And then
Mhm.
go ahead. Is it getting worse, better, the same? It should be like, clockwork at this time. So
Okay.
yes, you have to, you're still thinking, you do very, very well with following the patient. That's very good. You're very in tune with the patient. That's a very big plus for your
Okay.
CIS. But you also have to pick up the pace. So
Yeah.
that is that's important there. Now you did ask a lot of great questions. I love that you asked about stiffness. A lot of people the significance of stiffness in pain is very, very big. You can think of a great number of diagnoses.
Mhm.
I like that you asked about the signs of inflammation. I like that you asked about stuff with autoimmune issues like photosensitivity. I would have also asked, I love that you asked about miscarriages and abortion. She's
Yeah.
67 years old. Obviously, she's not having a period. She's probably done with her PAPSA at this point. But
Yeah.
asking about miscarriages and abortion is important. This could be SLE. We don't know. This is a joint
Okay.
pain issue. But what I would have liked for you to know, would have liked for you to ask, is about her mammogram. So she's
Oh yeah.
already told you, yeah, and the mammogram is important because where could this malignancy be coming from?
Oh, the breast. Yeah.
The
Oh.
breast likes to spread. Yeah, the breast likes to spread there. They like to spread to the lung mainly. They
Mhm.
could cause bone, so they like to spread to the bone and the lungs. So that's very, very big. So you want to ask her if she's up to date with her mammograms. And also, you might as well just add in colonoscopy on top of that. She's 67.
All
You
right.
want to make sure your preventative measures, preventive questions are great. Are good. And this is probably why the weight loss is there because she may
Yeah.
have a
Yeah.
malignancy. Right.
Mhm.
Um, so what I would have also liked for you to ask is, I know you asked about the night sweats later on. Don't
Yeah.
forget chills. What makes it easier is that if you ask about fever, what should naturally follow along after that is
Oh,
night sweats and chills. It should be a
those. Okay.
natural thing. It should be attached to fever at this point, so that way you
Mhm.
don't forget it.
Okay.
I actually had a lecture on class today on just fever, the actual clinical lecture on fever. You'll be amazed how much stuff is just under fever. So
Mm.
night sweats and chills is something you don't ever want to forget when you're asking about fever. Um,
Okay.
Ask about recent trauma too. You did ask about surgeries in the past, but recent trauma to the neck.
Mhm.
She did tell you that there was, movement to the neck to the left when she called for a friend, or but I guess when a friend called to her, but ask if there's an actual trauma to the neck. That's a lot of us doctors tend to forget the simple questions, right? We could
Yeah.
be going
Yeah.
there looking through books and textbooks, like what could this be? And all of a sudden it could have just been what if someone just hit her in the neck this
Yeah.
whole
True.
time? So, um, also some more neurological symptoms would have been great: headache, vision, dizziness, because you're talking about the weakness and numbness.
Mhm.
So, okay, some things you did ask twice. So fever you
Yeah.
asked twice. Fatigue you asked twice in two different ways. I know in reality, fatigue and feeling tired could be a little different. That's if you're
Mhm.
gonna go really crazy with the explanation, because when people say I feel tired, you don't know what that really means sometimes.
Yeah. Yeah.
But fatigue, I understood what you asked about fatigue. I said no. Travel you did ask twice, I believe. So that takes up your time.
Yeah. Yeah.
Okay, now let's go to the physical examination. I liked it. I know I'm not there with you, but I want to make sure when you're examining the neck, you have to go from cervical all the way down to lumbar, because
Okay.
you're looking at the spine. If this is a
Mhm.
cervical fracture, you got to check the whole vertebrae. Remember,
Yeah.
she has osteoporosis. She's also
Mhm.
an older woman. So you have to go from palpating again. Do the same thing you would do in disc herniation. You would start with you want to do the spinal processes first, from neck all the way from
Yeah.
neck down to lumbar, and then don't go to sacral. And then you want to also do the parasternal paravertebral area from the cervical to the lumbar as well. That way you get, because you actually do have to do a back exam, since the spinal, the vertebrae is continuous.
Yeah.
So it could be other fractures. Okay,
So
other than that, go on. What's your question?
wonder, there's just a move, like I wouldn't say move the neck. Would you say about back movements, or would you leave
No,
it?
I probably wouldn't even do back movements. I think if she's in pain, she's telling you that she can't. If she moves it,
Yeah.
it goes to an 8. I would definitely don't want her
Okay.
to move it. I just want to check if there's any broken bones, and I
Okay.
just want to see. But you do want to assess how far she can move it. You don't have to go crazy. So I think
Yeah.
what I would have done in this case is, okay, I know tell her, like, kind of prime her, let her know before. Look, I know it hurts when you're moving it. I just want to see how far you can, and then as far as she can move it, that's what you note in your paper. Her range of motion, is it, and remember, you want to do passive and also active. Okay, so let's
Yeah.
remember, when we do musculoskeletal, we got to remember, we first inspect, right?
Yeah.
Then we
Yeah.
palpate around the area. You're checking for warmth, you're checking for tenderness, you're checking for, any cuts, anything, but inspection, palpation, okay, checking for any edema, stuff like that. And then you want to go with your range of motion. You want to do passive versus and active range of motion. First, passively, you want to move it with your own hands, and then have her do it. So just see how far she can go.
Yeah.
As far as flexion, extension, see how far she can go. So that's still something I would try to do. But if she's in a
Mhm.
lot of pain, I would stop it right away. And
Okay.
then again, going on with the checking from the spine, the cord all the way down. Now,
Mm.
because you're running out of time, you didn't really have time to do everything else. But of course, if you're really cutting time and you couldn't have time to do your general examination, make sure you do your sensory, your motor, your reflexes, which you've done.
Okay. Yeah.
Okay. So other than that, you did pretty good. I think you're really good. You just got to pick up the pace,
Yeah. Yeah.
because those questions, you're thinking too much. The whole point of doing this OPD and also having your system for is to keep it coming. Yes, you're going to be thinking over, you're following me, you're thinking, but that shouldn't take up so much time. Okay.
Okay.
All right. So